Okay, welcome back to One Voice Radio Media. We have a very special guest with us today. We have Sarah from the Talking Therapies department here at Pure. So thanks for coming in.
Thanks for having me.
Do you want to tell us a little bit about yourself just before we start?
Yeah, so my name's Sarah. I've worked for Pure Innovations for nearly 6 years now. Started working with people with learning disabilities as a job coach. And in the last couple of years, I've gone back to university and retrained as a therapist to work for Talking Therapies. I live in and love Stockport, and I'm very passionate about where we live.
Me too.
Big up, the viaduct's massive.
Viaduct massive, or whatever we are.
And I'm very passionate about our borough. I think there's lots of really good things going on.
Yeah, no, I agree. Whereabouts?
Offerton. Near Stepping Hill, where all the sirens are.
Reddish.
You're Reddish.
Yeah. I'm proud. That's even a thing. Right, so the guys, we've got some questions here. I'm sure Reece already sent you them.
Thanks.
So we'll go in order of how we've got them down. So James, if you ask yours first, mate.
What is Talking Therapy?
So Pure Innovations Talking Therapies is a free NHS service that's intended, it's there to help people who feel sad, worried or stressed. And you can talk to a trained person called a therapist, like me, who will always treat you with kindness, respect, listen and offer you better ways of coping with life. Your therapist will teach you simple ways to cope and feel a little bit more in control. We know that life has ups and downs and they are part of life, but it's recognising and understanding how we can cope with them when we feel that things are tough.
Yeah. Answer. Right, Rob, do you want to ask yours now, mate?
Okay. Can you tell us how Talking Therapies helps people?
Yeah. So, Talking Therapies, first of all, is a safe, private space where you can get help and feel better. And it's really important to recognise, first, guys, if you are struggling with feeling low mood, you're worried, stressed, upset, sad, it's okay to ask for help if you do need support. Yeah. The service will give you easy ways to feel calmer and happier. There's no magic wand, is there? Yeah. No. But by looking at different ways to cope and feel more in control, give you better ways to manage your worries, because we all worry. Better ways to feel that you're more in control of negative thoughts. Perhaps improve your sleep or reduce irritability or feeling annoyed. There's lots of ways we can lift your mood and help you feel happier. So we'll talk with you and listen. We'll help you to understand some of your thoughts. We'll look at coping skills and how to feel more in control.
Lovely. So Louise, it's you next.
Hello. Yeah. Do you help people with worrying anxiety?
Absolutely, Louise. Yeah, lots of people that come to us are coming because they've got worry or anxiety. It's important to recognise again that worrying is a normal part of who we are as human beings. Yeah. But if we feel that we're worrying all of the time and it's taking over our daily lives, then that's when we may need to have a look at getting some help for that. It's okay to worry. But if we're feeling it's all of the time, we can look at doing some work on controlling your worries rather than them controlling you. And there's lots of different little tools and techniques that we can give you in sessions to help you manage those worries. And we'll always understand we've heard everything from everybody. Nothing ever surprises us. So it's very much a safe, non-judgmental space as well for you to tell us what you're struggling with and what you're worrying about.
I've got a question. So, obviously, does this mean that you can remain anonymous? Is that an option, or would you need the details of the person? Yeah. Because I know, like when you ring someone like Samaritans, it can be anonymous, can it? But is it more of a you need to know enough about them to? Yeah.
So. I'll come on to the Samaritans and anonymous support lines in a moment if that's okay.
Yeah.
But we would need your details if somebody did need to access our service or want to be considered for support. We would need their details.
Right.
And so it doesn't remain anonymous because your therapist has to know who you are.
That's true.
However, everything we talk about in sessions is private.
Yeah.
And we wouldn't ever disclose or tell anybody about what we talk about unless we felt that you were at risk in some way,
Yeah.
or somebody else might be at risk.
Yeah, that makes sense.
But normally we would feel that if somebody did want anonymous mental health support
Yeah.
and they were really struggling, then we can provide crisis numbers like Samaritans
Right.
or other mental health crisis
Oh,
numbers
right.
as well.
Yeah.
I could share those with you after, Harry, if that might be helpful. If you
Yeah,
want to keep
yeah,
them here.
yeah, definitely. If we could stick them on the walls,
Yeah.
just in case.
Okay.
Yeah, excellent.
Thank you.
Sarah.
How long is one talking therapist session?
So usually, if we can work with you and give you some sessions, we would firstly offer you up to 6 to 8 sessions. Now, usually, we would be able to offer 30 minutes per patient or client. But we know sometimes clients with neurodiversity, learning disabilities, or ASD or autism may need us to be more flexible and allow longer sessions or perhaps shorter sessions. So we would work with you as an individual to understand what is the best length of session for you. So I'll give an example if that's okay.
Yeah, go for it.
So I've got previously worked with a young man who had a learning disability, and we needed to make the sessions longer to give him time to process his thoughts and think of how he would answer some of the things we were looking through.
Yeah.
So sometimes we might need a 5-minute break as well.
Yeah.
So we can adapt to your needs and how you best respond as a patient or client. And we don't want it to become overwhelming for you, so we'll do all we can to make those adjustments.
Yeah, it's like a whole different ball game in it sometimes
is, yeah.
with how you go about it.
Can't
Yeah.
be too prescriptive either, and we're lucky that our commissioners at the NHS allow us to do that.
Yeah.
So
Yeah, it seems essential. Kofi, do you want to ask yours now, mate?
Do you talking therapies on the phone or online or face to face?
thanks, Kobe. We offer face-to-face our office in Hazel Grove. Some people find it better to sit down and talk about how they're feeling with someone in person.
So that is Prospect
House, yeah.
Right, okay.
And we've got a really nice, quiet, private therapy room there for people who need that face-to-face space.
Yeah.
We also offer telephone as well, treatments, and also video assessments as well. So
Okay.
we can use whatever the patient prefers, whether that's Teams,
Yeah.
Zoom, or even sometimes we can use WhatsApp video as well.
Okay.
It's more accessible to people.
Yeah, that's good.
So,
Means some people might not feel confident enough to go in person. Will they find it a bit easier to do it from their own home?
exactly.
Yeah, that makes a lot of sense. Right, where am I up to? Rob, you want to ask yours again, mate?
Okay.
I think this kind of ties into a lot of stuff you've been saying. The next question.
Okay. Do you make things easier for people with learning disabilities?
Yes, Rob, we do. That's why we're here.
Yeah.
Talking therapies can be really effective for people with learning disabilities, but we know we often need to make adaptations to meet individual people's needs.
Yeah.
And we know that by making adaptations or adjustments can reduce communication barriers, help understanding, and help patients express themselves and talk truly about what they're struggling with. And your therapist will always be flexible, patient, and creative in adapting an approach.
Yeah.
So we can use simpler and clearer language, work with your ways of communicating and understanding. We can got lots of good treatment material that uses visual aids, so photos, pictures, diagrams, symbols. Work at a slower pace. And also, with your consent as the patient or client, we can involve your support people as well, involving carers or family, to help you practice your skills outside of therapy as well. But that's only if you wanted us to do that.
Yeah. Yeah, that makes a lot of sense. Louise?
Hello. Do you have pictures or easy read sheets to help people understand?
Yeah, we do. We've done quite a good job, I think, within the last few years of changing very, very lots of pages of writing.
Of words,
Yeah,
and words.
yeah,
Yeah, I know what you mean.
into easy read visual aids for patients, and there's every treatment that we've got has easy read versions which are more visual, Louise, than just lots and lots of text.
Yeah, we've worked with them a couple of times, haven't we, in your job role? We
Yeah.
kind of try and go through the easy sheets. It just breaks it down a bit more. It's a lot easier for both of us to kind of, because I don't have a clue what's going on. I mean, you're the one with the job, so I have to try and keep up. But yeah, I understand. Sarah.
What happens if someone feels upset or unsafe?
Unsafe, yeah.
Well, first of all, it's important to recognise that sometimes feeling upset when we're talking about our feelings is a normal thing to do. And it's okay to feel upset or sad or cry. But if we're feeling upset because we feel unsafe or somebody else is unsafe, it's important to recognise that we may need to speak to somebody else to get you or somebody else the support and help that they may need. And that's our role above all. If we think someone else is in danger, we may need to tell other people, maybe the doctor, the social worker, or maybe the police to get you the help. But we'll always try and be honest and tell you that we're doing this and why. And we will tell you before this happens, unless it's an emergency.
Yeah.
Yeah.
Has there ever been like a time where does it happen often where, because some people may like just come for one session and then after that they're a bit, I don't know, I'm trying to think of the word. There are times where they don't feel like they need any more and they just come for the once just to let it out and then that's it then, and then they kind of...
Well, there's a process. So if someone refers to the service, we have to assess them. So that means me or one of the other therapists having a conversation face to face or telephone or video to understand what they're struggling with, why they're struggling, and understand the impact that it's having. So if you're not sleeping because you're worrying about having to go to work the next day, we know, for example, sleep can affect our appetite, our energy levels, our motivation. So we want to understand what's going on for you at assessment.
Yeah.
A lot of people feel better straight after assessment, Harry.
Yeah, and just
because they feel that they've had this release.
That's what I thought. I mean, you never know, you might just have had to get it off your chest and then you kind of just crack on then.
Most people do have like a goal or an idea of what they'd like to get out from some sessions. So we do, if someone's suitable for treatment, we would recommend that they take the 6 sessions on offer. Because it's about giving people tools to prevent them from becoming anxious.
Yeah, instead of a quick fix, it's a long term.
So it's rare that someone would just come for one session. Most clients, I think the average is five sessions that someone would have.
All right, then, makes a lot of sense. So that. Oh no, we've got one more. I think this is just the last one from James.
Is there anything you'd like to ask us?
Yeah, I would. I just wanted to know what we're recording today. Who does it go out to in terms of what do you do with the recording now, guys?
Well, we go to Pure Radio.
Okay.
So that means that most of the radio stations will get the signal on, get most of the things out of it.
Right.
I mean, to be perfectly honest, it is up to you. We could put this on the YouTube channel. We could stick it on the radio, or we could do both. But yeah, we try and keep podcasts as well are really popular. So trying to keep that vibe's also a good idea. But yeah, I mean, we'll speak about that after we're done. But is there anything else for you guys as well? Have you guys got any questions? Remember what we've been talking about. If there's anything you do want to ask, then now's the right time.
I can stay for a little longer as well after we've done the recording. If anybody does want to ask me anything privately or have a chat in confidence.
Do you want to ask something? Do you want to ask it on air or privately?
Privately.
Right. Okay. Right. I mean, that's everything from me. Is that everything from you guys? Sure. Yeah.
Yeah.
12 views now.
No, that's great. Thanks everybody.
Well, thanks for coming in. Yeah, I mean, we'll probably get this on the channel some point in the next couple of days.
That's great. Good plan.
Thank you very much.
Thank you.